Hello everyone, my name is Yogini Jani. I'm a Health Foundation Improvement Science Fellow and a consultant pharmacist. My presentation will take you through what factors influence prescribing decisions for patients with known allergies. This work is part of my Improvement Science Fellowship funded by the Health Foundation. The overall fellowship looks at the safety of antimicrobial prescribing in patients with penicillin allergy. As part of this 3-year fellowship, I've been looking at the scope of the problem, focusing on the behaviours both from a patient and a professional perspective that lead to the potential for harm, identifying the potential strategies that may be implemented to mitigate and address some of the issues and concerns, and looking at ways of testing and spreading these using an improvement science and studies approach. By way of a background, as a medication safety officer, I'd often come across situations where patients report allergies to penicillin, but don't always have detailed information. This then leads to a clinical decision to be made by the prescriber and the treating team on whether or not to use penicillin for a particular patient. Many patients don't react to their penicillin-based antibiotic if it is prescribed, but some patients, despite declaring and having the penicillin allergy on record, may be given a penicillin to quite significant consequences, and this particular example illustrates where, when things go wrong and when the allergy is a true allergy, that information and that decision making can have fatal consequences. There is increasing evidence which shows that self-reported penicillin allergies, and often even documented penicillin allergies, may not be an accurate reflection of the true nature of the allergy or the reaction that the patient and person experiences. There is a body of literature which shows that there is a cost to the patient in terms of adverse outcomes, recovery times, and also in terms of their treatment choices. There's also adverse outcome from a financial perspective in terms of the pharmacoeconomics, but also more broadly in terms of things like antimicrobial stewardship, whereby the choice of antibiotic becomes less focused, and there is a risk of using broad-spectrum antibiotics in patients who are reported to have penicillin allergies when they may not need them. National guidance is available to help determine the true nature of the allergy, to make a diagnosis, and to manage the communication of that allergy between care settings, health professionals, and with the patient. There's also evidence coming through which shows that penicillin allergy labels may be removed, and this can be done through testing, through risk assessments, and through oral penicillin challenges. In doing so, spurious penicillin allergy labels may be removed and help with managing any uncertainties at point of prescribing and treating the patient. A recent review that I carried out showed that although penicillin allergy delabeling services are gaining favour, there remains a gap in the research whereby there isn't sufficient information or evidence exploring the views and engagement of patients and healthcare professionals to understand what determines the decision-making in declaring an allergy, but also what determines the decision-making when making choices of treatment when faced with patients who have a recorded allergy and may require a penicillin-based antibiotic. So the aim of the study I'm reporting today was to better understand that clinical decision-making and the factors that influence that. So I wanted to evaluate doctor, nurses and pharmacist decisions to treat patients with a known penicillin allergy using a penicillin-based medicine. I was interested in assessing the variability between professions and grades, depending on what they perceived to be the risks or benefits at the time of decision-making. In order to do this, I used a judgment analysis approach. A number of qualified staff and medical and pharmacy students across 2 schools, and 4 healthcare organisations, hospitals. The range of responses came from doctors, nurses, pharmacists of all grades and varying experience and expertise. The results showed that there were a number of factors that reduced the likelihood of treating with the penicillin when faced with information about the allergy status. And one of this was the prescribing system. So any kind of IT-generated alert in a prescribing system would lead to a reduced likelihood of going ahead with that decision to treat. This was also the case when a previous clinician may have overridden an alert when our respondees were given the scenario and they chose that they were less likely to go ahead with the treatment. Students of both backgrounds were also less likely to carry on with the treatment. They exhibited a more cautious behaviour. They were following the sort of textbook taught mechanisms of if an allergy is documented, one must not continue. Other factors increased the likelihood of going ahead with that treatment. So, for example, in cases where the infection severity was high and the patient required treatment in a timely fashion, the decision was more likely to be to go ahead with that treatment, especially if the information about the allergy was uncertain or not very clear. Similarly, if the advice came from an expert, so microbiology department, or there were culture results that supported the use of a particular antibiotic, this increased the likelihood of going ahead with treatment. And if treatment had already started, so if the patient had received 1 or 2 doses or had received treatment previously, there was an increased likelihood that that treatment would be continued despite having information which showed that the patient had a recorded allergy. Key themes that emerged from the free text, so the survey also included opportunity to provide explanations or rationale for any decisions that the respondees made. These themes showed that the professional background made a difference. So, for example, as a decision maker who needed to commit to a prescription, the prescriber, they were more likely to go ahead with the treatment but still check up on certain information. Whereas those who were in a more supportive role or a more reactive role, such as the nurse or the pharmacist who would need to act on that instruction, they were more likely to not go ahead with the treatment or respond no to the treatment decision pending further information. The sort of information both professional groups were looking for were very similar, and these linked to where the information about the allergy status came from. What was the certainty of that allergy status, and how much confidence did that decision maker have in the information that was presented to them? Whether or not alternative options were available. So if an alternative non-penicillin option was available and considered effective, that would be the preferred choice rather than a penicillin-based antibiotic. The time, both in terms of timeliness of treatment, so the urgency, but also the time at which the decision was being made, also influenced whether or not the treatment would go ahead. And then the presence or absence of policies and guidelines. So a number of free text responses indicated that whilst the choice would have been to continue with treatment, they would not go ahead in certain situations because that's what the policy recommendation was. So there were quite a number of factors that came into play when decisions were being made about whether or not to treat these patients. The implications of these findings are wide-reaching. I started the presentation by saying that penicillin allergy status, especially self-reported or spurious labels, have an impact on the patient's treatment. And the findings have shown that the decision-making, whilst partly influenced by that label, is also influenced by a number of other things. And these include the patient themselves, the severity of their condition, any comorbidities they may have. The individual who's making the decision, their knowledge and their experience, the seniority they had and the autonomy they had, the role of that individual in terms of the decision making. Are they the decision maker and the person who will instruct, which will then lead to a series of subsequent events, or are they the person in response to an instruction given by somebody else? And finally, the system within which the decision is being made, both in terms of the prescribing system, so prompts on a paper prescription chart or alerts on an electronic prescribing system, but also the governance infrastructure and prescribing support available in a more broader sense. So is there a microbiology department? Is there guidance available? Are there pharmacists who will be reviewing prescriptions before the medicines are being given? What is the role of the nurse at the point of administering the medicines? So a whole series of other factors come into play when making decisions about whether or not to treat a patient. And therefore, even if we manage to improve the quality of the labels for patients who report penicillin allergies, it's important to continue understanding the behavioural elements and what drives the decision making at the point of care, both from a clinician's perspective who's making that decision to treat, but also the patient's perspective when they are reporting their allergy, to have that conversation about what would influence their treatment depending on how they report their allergy. So I'd like to thank you for listening. I hope I've demonstrated that a number of factors come into play when making decisions about patients with allergies and their penicillin and other antibiotic treatment. If you do have any comments or questions on this presentation, please add them as a comment below the video and I will read and respond as appropriate. If you'd like more information, feel free to contact me directly. And if you're interested in hearing more about the overall project and how I ended up doing this project, a podcast is available on the Anti-Waffle podcast listings, and please take the time to listen. Thank you very much.